our next presentation with Dr. Beth Wahler. So yeah, again, please put your questions in the Q&A and we'll get to those at the end of Beth's presentation. So yeah, we're trying for about at least 10 minutes at the end for questions. Okay, so yes, I'm very excited to introduce Dr. Beth Wahler. Beth is the director of the School of Social Work at the University of North Carolina, Charlotte in the US, and founder of Beth Wahler Consulting. She is a researcher, educator, consultant, and social worker that has collaborated with both individual libraries and large library systems throughout the US to connect needs assessments of their patrons' psychosocial needs and staff challenges with these types of patron needs, provide training to library staff about trauma-informed approaches to address their patrons' psychosocial needs, and has created and piloted various interventions to address these patron needs, including collaborative social work and library programs. She has presented widely on these topics and has published numerous articles on library patron and staff needs in peer-reviewed journals. She also has co-written a forthcoming book called Creating a Person-Centered Library, Best Practices for Supporting High Needs Patrons, to be published by Libraries Unlimited in 2023. So yes, her presentation today is about trauma-informed librarianship. And that's off to you, Beth. Thank you.
Thank you so much for that introduction. Hopefully everybody can see my screen that I'm sharing.
Yep, looks good.
Great. So I really appreciate having the opportunity to talk with everyone today. It's so exciting to me that there's so much global interest in this topic. And I have to apologize first. I have been very sick over the last week or so, so I'm going to try to get through this next 45 minutes without coughing and do my best to get through this, but I apologize in advance if that happens. But I'm going to start out just by telling you a little bit about me and how I come to this work and what this presentation is going to be about, and then I'll dive right in and talk about trauma-informed libraries. So I am currently the director of the University of North Carolina at Charlotte School of Social Work in the US. Before going into academia and research and teaching, my practice experience was primarily with people who were living in poverty, who had different things that were barriers to economic stability and mobility. And the main barriers I worked with were substance abuse problems, mental health problems, housing instability, sometimes intimate partner violence, different kinds of trauma, but things like that. So I fell into library social work collaborations and library social work by accident, basically. I was working in a different state at a different university and was approached by a library there who needed help with the patron issues that they were dealing with every day. I have since, I very quickly actually learned that those are very common patron issues, but until that time, I didn't know. I collaborated with that library because of my research interests and because of my practice experience with the same kinds of populations that they were having visit their main branch of their library. We did a needs assessment. We piloted student practicum placements there. We continued to gather data that they were able to then use to hire a full-time social worker eventually. But we started publishing and presenting on our work there, and then libraries started coming out of the woodwork from across the United States and eventually from other countries as well, who were describing very similar issues and asking for help with the same kinds of needs. So over the past several, 6 or 7 years, my main research focus became initially library patrons' psychosocial needs and how libraries could help patrons with these kinds of needs. And then recently, it's really sort of morphed more into focusing on how we can better support library staff, because I've learned that, that library staff are experiencing a great deal of trauma, stress, and burnout. And I believe very strongly that libraries are essential organizations that really hold our communities together and offer essential services to so many oppressed and vulnerable groups of people and marginalized people. And we have to protect the workforce. So most of my current work is focused on trauma-informed libraries and how we can help support staff and decrease staff stress and increase staff resilience. I also have a consulting business now called Beth Wahler Consulting that does work primarily with different libraries around their own individual needs, training needs for staff, organizational assessments, things like that. And then I do have the book coming out that's co-authored with Sarah Johnson. Some of you may recognize her name from the Social Work Library Intern website that she maintains, and many of publications that she has had in the field of library and social work internships and in library-based social work internships in particular. So we've got our book coming out in 2023. And in our book and in the presentation today, I'm going to try to strike a balance between talking about how libraries can help patrons, but also talking about how libraries can support staff. And I feel like it's very important that we constantly try to focus on that balance, because libraries can't focus on serving patrons adequately if they are not able to adequately take care of their staff. So in the presentation today, I'm going to talk about just the basic principles of trauma-informed librarianship and how trauma-informed care can benefit both patrons and staff in a library. I'm going to provide some examples of how trauma-informed librarianship looks in practice. I'm going to include information about how library-based social workers can help with trauma-informed librarianship, but I know that many libraries do not have social workers and will probably never have social workers. So I've tried to include some strategies that libraries can use that do not have social workers on staff or students that are working with them. Just a little disclaimer, most of what I'm sharing about today comes from my research here in the US. I do a lot of collaborative work with libraries in other countries as well, but most of the work I'm going to share is really US based. So I just want you to understand that, and that some aspects may be similar to what is being experienced in other parts of the world, but there really are some different cultural contexts that have to be taken into consideration when we're talking about trauma, library work, and social work. And research really needs to be done in that specific cultural context to know exactly what works locally. So I talked in my introduction, I'm going to talk a little bit about library patrons' psychosocial needs. And what I mean by that term is basically any psychological or social or environmental factor that's associated with chronic stress or strain for general populations and poor health outcomes for general populations. So these can be things like mental health problems, social isolation, substance use problems, poverty-related needs like housing instability, food insecurity, difficulty with transportation, financial needs, things like that. All of these things are social determinants of health, and they're predictors of poor health outcomes and increased stress and strain in populations across the world. We know from recent research over the last decade or so that library patrons' psychosocial needs have been increasing. And those increases have happened for a number of reasons that are sort of beyond the scope of my presentation today. But a lot of structural reasons and societal reasons that we have seen these increases in needs that library patrons have. What we know from research, again, mostly here in the US, is that the top areas of patron need tend to be homelessness or having unsafe or unstable housing, having mental health challenges or untreated mental health issues, having substance use problems, sometimes even overdosing in the library bathrooms or in library spaces, and then general poverty-related needs. In libraries that serve a great number of people who are experiencing homelessness, we tend to see greater numbers of these needs. So the more patrons that you have in your library who are unhoused or who have unsafe or unstable housing, the more likely they are to have some other compounding needs that also make things a little more complex and difficult with intervening effectively. We do see increases in these needs because of the COVID pandemic, and we expect these needs to continue to increase because of the fallout of the pandemic and this ongoing pandemic that we're in. And although the frequency of needs varies between urban and rural libraries, we see the same types of needs in rural libraries as we do in urban libraries. So I know urban libraries in particular have gotten a lot of attention for some research that's been done specifically in urban contexts about trauma that's being experienced, about patron needs, about violence in the library. But I actually just finished a needs assessment with the state and compared urban and rural library patron needs and staff needs, and saw that even in the rural libraries, staff were experiencing the exact same types of needs and patrons were coming in with the same types of needs. Just the frequency varies a little bit because often patron numbers are a little lower in rural libraries. Many of these needs that we're seeing are trauma related for the patron. There's a cyclical relationship because they're trauma related for the patrons, but they also can cause trauma for the staff that are working with patrons with these needs. So when I'm talking about trauma today, I talk about this term very loosely and broadly. There's a definition from SAMHSA here in the United States for trauma that's the 3E framework. And it means that for something to be considered traumatic, there has to have been an event that happened, and that can be a one-time event or something that was chronic and happened multiple times. We see the experience of that event as being something highly negative, really scary, frightening, life-threatening. And then there's a long-term effect. So those are the 3Es. And these things are different for different people. So what is traumatic for one person might not be traumatic for another based on the meaning that they ascribe to that event, or how they experience it, or how it impacts them long-term. But traumatic events include lots of things. So we tend to think of physical violence that's happened, intimate partner violence, sexual abuse or violence, being in war or being exposed to some sort of ongoing violence, any kind of life-threatening event, a serious medical event can be traumatic, the fear of being assaulted or killed. There are a number of things that can be traumatic for somebody's life. And depending on when they happen, how often they happen, how frequently somebody has a traumatic event that happens in their life, they could experience a range of symptoms or sort of results from that trauma that they experienced. Trauma all across the globe is prevalent, no matter what country we're talking about. And really, estimates show that about 70% of the global population has experienced at least one traumatic event in their lifetime. The average is 3.2, and many people are exposed to chronic trauma over long periods of their life. The effects of trauma, again, vary based on what kind of trauma somebody experienced, how often or how frequently it happened, and the circumstances around those traumas. But generally speaking, trauma can cause a number of effects on any of us. And it can affect our emotional regulation, so our ability to identify our feelings, regulate our feelings, control our own impulses, our cognitive functioning and our ability to concentrate and focus and form memories. Our physical and mental health can be affected by trauma, especially substance use, mental health problems, suicidal ideation is impacted by trauma. Our perceptions and beliefs about the world, so how safe we feel in the world, how much we have optimism or hope about the future. And then our relationships with other people are impacted by our own trauma experiences. So having safe and healthy relationships and being able to set boundaries and really express our own wants and needs is impacted by our own trauma experiences. Because libraries serve so many people who, I just, shared that statistic that about 70% of the whole global population has experienced some sort of trauma. Because libraries serve the public, you are going to see a huge number of people who've experienced trauma. We also know that libraries, sometimes public libraries, disproportionately serve really sometimes very marginalized and vulnerable and oppressed groups of people who often have been exposed to even more trauma than just the general population. So again, you can sort of count on having a large number of people in a library who have experienced trauma. And we see impacts of that on patron behavior. So oftentimes when we're looking at patron behavior, again, depending on exactly what kind of trauma happened, we might see patrons who have trouble with social interactions and trouble interpreting social cues with other people. There might be patrons who become irritable or easily escalated, or they seem rude or impolite. Sometimes we see people who really want to be isolated and quiet and keep to themselves, but we also sometimes see the opposite because of trauma, with people who may almost create chaos wherever they go, and they sort of make things loud and chaotic. We see increases in substance use in people in the library that have experienced trauma. We sometimes see people who become really volatile, or they're angry when things don't go as planned. And we do see people, based on what kind of trauma they have, who may have inappropriate flirting or sexual advances or sexual behavior with people in the library. We also know that because of all of these things, we see a lot of library workers who are experiencing trauma. This is an emerging area of research. So there's less research on library staff trauma than there is about patron needs at this point. But the research in this area really has found that library workers in all kinds of libraries, urban, suburban, and rural, report high rates of trauma from workplace-related incidents. Over half report experiencing violence on the job in the library. Incidents include things like verbal abuse, sexual harassment, being threatened with weapons, having library property destroyed, being threatened with violence, having patrons who are aggressive and attacking them. Sometimes library staff even report trauma from other coworkers in their library. These incidents have increased since the COVID pandemic began. And we see, because of these things, that many staff are experiencing symptoms of their own trauma because of their work, or they're having the worsening of a pre-existing mental health condition because of what's happening in their work. When we see staff in libraries who've experienced trauma, we tend to see staff who are describing feeling burned out or saying that they feel really depressed. We see staff who report feeling really powerless or ineffective at work in the library. We see staff who are calling in sick or dread coming to work, might be really irritable, feel really frustrated with people. We see people who used to be creative who have lost that creativity, who might have difficulty concentrating or focusing, might say that they can't sleep right now. Some library staff are using unhealthy coping mechanisms themselves, like overeating or substance use. And we see staff who struggle with setting boundaries with people. So the trauma that is being experienced is impacting staff behavior and emotional well-being as well. With libraries right now, we really are seeing a compounding effect of a number of issues that are impacting library workers. We see firsthand experiences of trauma. So some of these are traumas that have been experienced in the workplace at the library, but also people come into their work at the library with pre-existing trauma and other things that have happened in their lives. We also see secondary and vicarious traumatization. What this is when people who may not have their own experiences of trauma are experiencing symptoms of trauma based on working with people who have experienced trauma. And this is seen frequently in people who are really, who have a lot of empathy, who are very caring. And in my experience, most of the people that work in libraries sort of fit that description. They're in that work because they care about people. So they're at risk for secondary and vicarious traumatization because of their work as well. And then we also are seeing a number of library workers who are experiencing burnout, which is a different concept, but is related and has some similar and overlapping symptoms. So all of these things, firsthand trauma, secondary traumatization or vicarious trauma, and burnout are really complex yet interconnected issues, which require us to have broad organizational solutions to try to fix. So one of those solutions is to try to transform libraries into trauma-informed libraries. So for the longest time, we've talked about trauma-informed organizations as, we focused largely on mental health care, on different kinds of social services, on making those sorts of organizations trauma-informed. But what we know is that there is such a prevalence of trauma everywhere that if we can make all of our public-facing services, as well as our private organizations and services, trauma-informed, we really can benefit everybody, the people who work in them and the people that we serve. So for libraries in particular, trauma-informed libraries understand how widespread trauma is. Usually it starts with some sort of in-depth training about trauma. Trauma-informed libraries learn how to recognize the signs and symptoms of trauma, respond to this knowledge, by integrating knowledge into practice and changing how they do their practice and their policies. Trauma-informed libraries focus on being sensitive to the traumatic experiences of others. They start to view difficult or problematic behavior through a lens of asking what happened to this person instead of what's wrong with this person, and really acknowledging that a lot of the behavior we see sometimes that is problematic is really a coping mechanism to trauma that people have experienced. Trauma-informed libraries attempt to reduce the negative impact of trauma on people using the library space and really focus on trying to resist doing further harm to people. And again, the focus has to be on both patrons and staff. So you can't have a trauma-informed library that focuses only on how patrons are going to be served. And instead, it has to focus simultaneously on staff. Whoops, something went all the way back there. Sorry about that. Let me get to the correct screen. Okay. So becoming a trauma-informed organization is an ongoing process. It's not a destination that you can achieve. It really is a long-term investment and a process, and trying to make sure that the whole organization really operates as a trauma-informed organization. The research on trauma-informed organizations in general shows us that when we transition something to being trauma-informed and widely trauma-informed, that it does benefit both the employees and the people served by that organization. It can prevent re-traumatization, which can actually reduce the need for care, like mental health care, cost of treatment, sick time, things like that. It helps create and sustain a welcoming place for everybody, which is really important when we think about the mission of a library. It's been found to reduce the number of escalating events or events that turn into disciplinary actions for people who've experienced trauma. And it increases morale, communication, and shared decision-making, and really overall satisfaction for staff and customers for people being served. So there are 6 different principles of trauma-informed care, and I'm going to talk about what each one of these looks like in a library. I've tried to condense this. This is actually a really long presentation that I've tried to condense into a shorter one, so I apologize in advance for the amount of information that's going to be crammed in here. But the 6 guiding principles of trauma-informed care are safety, trustworthiness, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. So I want to talk about each one individually and then talk about what that looks like in a library. So the first one is safety. And by safety, we mean both physical safety and psychological safety. And this is a tricky balance sometimes for libraries, because libraries, many public libraries, are having some serious safety concerns. And we have to be careful not to err so far on the side of physical safety that we neglect psychological safety. And sometimes physical safety and doing things like having security guards or armed guards in a library can actually then jeopardize the psychological safety for people in our library as well. So that's a balance, and there's a fine line there. But in a library for physical safety, what we're talking about is making sure that the space is kept clean, well lit, there are well-marked exits. There are policies that are in place to try to ensure the physical safety of everybody who comes in the library, patrons and staff, and that staff are trained to respond to emergency situations in the library, and they're as prepared as possible for them to be able to respond quickly. For psychological safety, we mean that the space is welcoming for everybody, that both administrators and staff model supportive and caring relationships with people, that the library really operates from a relationship first kind of approach, that people matter, their well-being matters, people are treated with respect, and that policies are enforced consistently so people know what to expect and what's going to happen if they don't follow policies. And there are clear boundaries and expectations. That's part of creating this psychological safety in a library environment. The second trauma-informed principle is trustworthiness. So this is about transparency, making sure that we actually live out our values and that we are doing what we say we're going to do, and that our actions in the library match our stated and professed values for our library. So in a library, it means that we are transparent with our policies and our procedures. We're consistent with how we apply them to everybody, that expectations are clear and publicly known. Patrons and staff are part of the decision-making process when possible, and that we communicate back to patrons and staff about the processes we've used to make decisions and what information we collected that led to those decisions. So it's about just being trustworthy and transparent and giving people the information they need to know what's expected of them in the library and to also know what to expect from us. The third guiding principle of trauma-informed care is peer support. So what this means in general is that we create a system where people at all levels in our library can learn from and receive support and encouragement from other people who have been there, done that, as we say. So in a library, when we're talking about patrons, this means in many libraries that we might choose to offer mutual aid or support groups in our library space. These aren't clinical groups, it's not a therapy group, but opportunities to bring people together over a shared concern or a shared struggle. We might highlight books by authors who have lived experience with that topic. So if we have books or collections that are focused on mental health, we're looking for things by authors who have lived experience with those issues. And we create opportunities in general for people to gather around shared interests and concerns. When we're talking about using the principle of peer support to support our staff in libraries, we talk about things like encouraging reflective practice or peer support groups. And I don't know how many of you are familiar with reflective practice, but that's a method that's been borrowed from social work and nursing and education and various helping professions that can apply directly to libraries, which I also consider to be a helping profession. And it's a process where you have a group of people together who, with psychological safety, so that piece becomes essential that I talked about a few minutes ago, they're able to process the day-to-day work that they're doing. They're able to talk about things that have happened at work, learn from them, learn from each other, identify skills they might need to learn, ways they need to improve. Reflective practice is an opportunity for us to really analyze our work, analyze our own reactions to what's happening in our work, and then learn and try to grow from that. So for staff, we have opportunities to add reflective practice groups or other peer support groups, and we can create opportunities for our staff to gather around shared interests and concerns. The next trauma-informed principle is collaboration and mutuality. So this is just the principle that we are all in this together. All of us as human beings are in this together, and that we really heal, progress, and thrive through the power of relationships with one another. So in a library, again, this means that we use a relationship-first approach, that we value each other as our coworkers, we value our staff, we value our patrons. We try to focus on using solution-focused language rather than problem-based language. We try to frame behaviors in a positive manner rather than blaming or shaming people, even when they're doing things that might be upsetting to us at first. We try to reframe problematic behavior as a coping mechanism that somebody has learned and acknowledge that that has served them well to this point. We focus on shared outcomes. We try to create mechanisms for shared decision-making. We try to reduce hierarchies and power differences when we can. And we ask people what they need from our library and then try to address those needs the best we can. The next guiding principle of trauma-informed care is empowerment, voice, and choice. So this is really focused on reducing those power differences whenever possible, giving everybody a voice in what's happening, and allowing choices whenever possible. So in a library, this means that we try to make sure that we are hearing all of our patrons' voices, and we give them opportunities to express their needs and wants, and that we are really focusing on voices sometimes from people who have been oppressed or coming from marginalized or vulnerable groups, because many times they don't have any other place for their voice to be heard. But in a library, we have an opportunity to make sure that everybody has their voice heard because we serve the public. We give patrons a choice of services, programs. We try to ensure diversity in our decision-making groups, our boards, our staff, so that all types of people are represented when decisions are being made and when there are discussions at the table about decisions that are going to be made. And we try to make programming decisions and policy decisions based on the feedback that we're getting from people. And the final guiding principle of trauma-informed care is cultural, historical, and gender issues. So this is just about acknowledging that there are contextual factors that impact somebody's choices and their behaviors. And we have to be mindful of those. And those contextual factors can relate to somebody's gender, their race and ethnicity, lots of different factors. And those cultural factors vary based on what country you may be tuning into this presentation from, or what region or what area. But when we're using this principle and applying it to our library, we want to make sure that we are being really mindful of and responding to the cultural needs of both staff and patrons, that we're reviewing our policies and practices for disparate outcomes for different groups. We change things when needed. We have culturally relevant programming and services. We work to make our library accessible by everybody and welcoming to all. And we really make sure and we're intentional about assessing the needs of marginalized communities and making sure our library can be used by them and for them. So how library-based social workers can help? So for libraries that are lucky enough to have a social worker, social workers are trained to address many of these different things and these different principles. And social workers are trained to work across what we call the micro to macro continuum of services. So micro-focused services are very individually focused. Right now, this is what's getting the most attention in the media for libraries, is having a social worker in a library who works individually with patrons. But social workers are also trained to work at the meso level, which is the group level, and then the macro level, which is the organizational or the community level. And really, if a library is fortunate enough to be able to afford a social worker or have a social worker on staff, they get more benefit from having that person operate at more of a meso and macro level than necessarily the micro level. So I just want to say that here. But library-based social workers can help with trauma-informed libraries by working on the micro level to address individual patron needs, to de-escalate crises when necessary, to help people get accommodations when they need them. At the meso or the group level, a library-based social worker can help facilitate a reflective practice group and teach library staff how to do reflective practice, or help facilitate a peer support group of staff. They can provide training on boundaries, self-care, other strategies that might help them build resilience and deal with the stress in their job. They can facilitate book discussion groups with patrons on trauma-informed topics or trauma-related topics. They can create or facilitate mutual aid support groups and help facilitate programming in your libraries about resilience, mindfulness, and self-care. At the macro level, which is the community or the organizational level, a library social worker can help review policies to make sure that your policies are equitably impacting everybody and there aren't any disparities for certain groups of people. They can create things like resource guides for both staff and patrons to help with connecting to resources when needed. They can analyze your space for accessibility concerns, help to inform safety protocols. Social workers are not security professionals, but they can help to look at your security and safety protocols and make sure, again, that they are as trauma-informed as possible. Excuse me. They can do needs assessments of patrons or staff groups, facilitate connections between your library and other community partners and organizations, and really help with trying to create and maintain a psychologically safe environment in your library. Now, for libraries who are here today who do not have a social worker and may not ever have a social worker, there are some things you can do. So one is really looking at your overall organizational approach, really focusing on trying to create a culture of care for staff, providing accommodations when needed, acknowledging mental health as much as you may acknowledge physical health, allowing sick days if that's possible for mental health as well as physical health. Creating opportunities to debrief after significant events that have happened in the library and really normalize discussing stressful things and difficult events that are happening. You can make sure that or try to advocate for an adequate support program for staff, which looks different depending on your own HR policies and where you may be located. You can consider incorporating self-care activities and events for staff. So sometimes there are community partners who will come in and do a mindfulness training or yoga or something for staff, even as a volunteer. You can implement shared decision-making protocols so that staff have an opportunity to give input on policies and practices and use feedback from both staff and patrons to guide what you're doing in your library. You can emphasize the importance of reflective practice and create space in your library and time in people's schedules to come together in groups to support one another and talk about and process their work. Sometimes talking about it and supporting one another is one of the most effective things that can happen for people to be able to grow in resilience and deal with the stress that they're facing. You can have plans for handling both psychological and physical emergencies. So I find sometimes that libraries have really great strategies for handling physical emergencies, but not so great strategies for handling mental health emergencies that may happen. So you can work to have established safety protocol for and emergency response protocols for those. You can offer staff training in mental health first aid. That's an evidence-based practice that is now being used globally. So I put here Mental Health First Aid International. It's being used globally, in multiple countries around the world to teach non-mental health professionals how to identify and then intervene in a mental health or substance use related emergency. It's been really helpful. It also increases the competence and the kind of security and confidence that staff have with these kinds of things, and seek consultation or support if needed. You can also create a trauma-informed work group to help assess and move forward with some of these strategies. And I'm going to skip ahead. I know we're out of time. I see Casey coming back on. So I want to leave time for some questions. So I'm going to skip a couple slides to my contact information too, if people have follow-up questions after this as well.
Yeah, sorry, Beth, that was such great information at the end too. So I held off on interrupting. But thank you so much. And yeah, some questions are coming in from the chat, which is great. Leah asked this question quite early in the presentation. I think it's a great one. If library staff are looking for personal development and they do seek this training, how will their current roles change or the job description change? And is this a fair change in relation to their compensation?
So in my mind, this doesn't change their role in the library. And if that person has some clarification and wants to offer that, please do. So this is more about changing the overall practice about how we support staff in the library and how we respond to patrons or think about patron behavior. It's not necessarily changing the day-to-day job of the staff person. And I may be misunderstanding the question. Is there more clarification from that person?
Maybe, and I was thinking of this too in terms of coming from the school library world, where we often get kind of tasked with teaching another class or doing things
Yes.
outside the role of the actual school library. Yeah, I guess just thinking of it more in terms of that extension.
Yeah, well, and I think we have to be careful. I think staff often have training fatigue. They get sent to trainings after trainings, and they're told they have to learn one more thing and one more skill and offer one more service to their patrons. And it gets really overwhelming. But this is more about an overall organizational approach to supporting staff rather than adding to their job. It's looking at how we can restructure things in a way to provide ongoing support for staff. And it's more about reframing how we think about patron issues or how we kind of talk about patron challenges that come up. It also sometimes leads to, many cases I'll see a library rewrite their behavioral policies in a way that's framed in a more trauma-informed approach. So it's not necessarily adding to the job, although sometimes it might mean a short-term, we've got to reframe our policies or kind of think about things differently. But long-term, it actually can help ease some of the stress on people in their jobs.
Thanks for that. And we had a question in the chat. In context of your experience and research, does social work fall in the daily JD of librarians, especially after COVID lockdown? I'm not sure what JD stands for.
Job description.
Oh, again, job description.
Oh.
Okay. Or should libraries look for joint venture with social work entities or a new way of service by being place providers to keep it sustaining in terms of finance and workforce abuse issues to serve the wider community? Maybe related to that other question too.
Yeah, I think I hear often from library staff that they feel like they're supposed to be social workers and that if they wanted to be a social worker, they would have gone to school for social work. And I do not expect any library worker to be a social worker. I think there are some strategies for working with people who've experienced trauma that can improve the workplace for both patrons for the staff that are there, and then improve services for the patrons that are being served. But ultimately, I don't think any library staff person should be expected to be a social worker or to be able to demonstrate all of the skills that a social worker has. And I think there's lots of room for collaboration. And sometimes that may mean a social work position on staff or a social work student in the library. It also might just mean a short-term partnership with a community organization that may come in and facilitate training or facilitate a program with patrons. So I think I think there's a lot of pressure right now on library staff to be all things to all people, and I think that's a really dangerous expectation for anybody to have, and it's unhealthy. And library workers are supposed to be library workers, and social workers are supposed to be social workers, but there are some things that we can learn from each other.
And Chris, also, I think from Yarra Plenty Regional Libraries, asked, how do you think that libraries should approach the necessity of social work as being essential in libraries with their councils and funding, I guess?
Yeah, that's a tricky subject, and it really depends on your local council or your local government and kind of what they're looking for. I have worked with libraries who have made a case for their for being able to hire a social worker and have been able to obtain funding, and they've done that through data and through collecting data about the patron needs that are coming in, the staff, the crises that are being handled, the various kinds of emergencies that are happening. And again, not just physical emergencies, but also these mental health situations that are happening or substance use related concerns. And then really telling a story of what is happening in the library, and also representing information from around the globe right now about these social work collaborations and how they've been able to help with some of those things. So I think councils and governments get concerned because they hear social worker in the library and they think that means the library is trying to be a social service organization. But it's not about that at all. It's really about connecting. It's still about connecting people to information needs. It's just a different kind of need sometimes, and it's responding to emergencies and crises that are happening in the space. So it's about showing what's already happening and how that's been successful, and then telling the story of that library and how bad things are. Because I think people in the general public, and sometimes that means the council or the government, don't have any clue what goes on in a library on a day-to-day basis sometimes.
Yeah, that sounds very, very true and relatable to lots of people in here, I'm sure. And I think maybe just one more question since we're going on a break next. This one's from Gay Richards. Have you considered the trauma-informed needs of patrons and staff who primarily interact over the phone or by email? For example, in a specialist information center, not primarily designed to provide client support.
No, that's actually a really interesting and intriguing research idea for the future, because that is not something we've specifically looked at, is the experiences of that particular group. So a lot of the research so far is focused on like frontline in-person staff. So that's a great idea and something that's worth looking into.
Great. Well, thanks so much for that, Beth. That was really great and very informative. Now we have a 15-minute break.